Welcome to the medical moment here at Marina Hills Animal Hospital. I'm standing here in our quiet room, as we call it, with our ultrasound unit. We use the ultrasound here at the practice for several different kinds of patients. The ultrasound is very helpful in an emergency situation to tell us if there are fluids, places that they don't belong. And that's both the chest and the abdomen. The ultrasound is helpful when we think a pet may be pregnant and we want to see if there are fetuses that are viable, so we can see the motion of the fetus heart and know that they are not just present but alive, which is very cool. We also use the ultrasound as a screening tool for wellness, particularly senior citizen pets or pets at high risk for developing cancer. We can use the ultrasound as a screening tool, search for problems before they become a big problem. But the thing we use the ultrasound for most often is to work up medical cases that are ill and sick. There's two ways that we go about that here at our office. My associate, Dr. Asha, has an interest and a focus in ultrasound and is quite adept at the study of ultrasound. And though she's not an internal medicine specialist, she's done a lot of imaging in her career. And she frequently does ultrasounds for our cases here in the hospital. The other way that we use the ultrasound, this particular unit is actually connected to the internet. When it's appropriate, we have staff members who are trained at the collection of imaging, and they can actually be assisted by sonographers who are not on site. They're in Texas. And they can help my staff members collect the images, turn left, go right, less pressure. They can activate the buttons remotely to capture the ideal images as a team working together. And then those images that have been captured are reviewed by a board certified internal medicine specialist. And within a day or two, we get a consultation that includes not only evaluation of the images that were captured, but also the history of the case that we provided, review of all images, both X-ray and ultrasound, review of lab test results, and the specialist then, in conjunction with one of our doctors here on staff, makes recommendations on further pet care. So, a pretty cool system that allows our clients to receive referral center level care without having to leave the practice, and many of our clients appreciate that. Of course, if there is a case that is very sick and needs care right now by an internal medicine specialist today, that can't happen here with this system. Those cases we do refer to our local specialty hospitals. If you're in the Saddleback Valley and your pet needs an ultrasound study, whether it's the chest or the abdomen, talk to the front desk and we'll be glad to see how we can help care for your pet.